first inaugural treasure chests, a panel on breast health. And we are so thrilled to have you all here today. My name is Katie Peterson, and I'm the Director of Public Relations and Marketing here at St. Peter's. But what I really want to spend time introducing you to, who I'd like to introduce you to tonight, are our 4 panelists. So I will start with Pam Sasser, who is our OB/GYN nurse navigator here at St. Peter's. And I hope everyone got a program. Inside all those programs are their bios, and it gives you a little bit more information on these fabulous folks and their background here at St. Peter's. So Pam, as a nurse navigator, Pam works one-on-one with a patient to minimize their anxiety and stress by helping them navigate through the healthcare system. She helps educate patients on their diagnosis, explains and coordinates treatment options, and improves communication between patients and their physicians and caregivers. She assists patients in working through the emotional aspects of the diagnosis and can connect them with community support groups and resources. Pam is also a Carroll grad and earned her nursing degree right here in Helena and Carroll. So please welcome Pam Sasser. Tonight, Dr. Alissa Abentroth, and Alissa Abentroth is a surgeon here at St. Peter's Hospital. She's board certified in general surgery and a fellow of the American College of Surgeons. She belongs to the American Society of Breast Surgeons, and Dr. Abentroth also serves as the director of the Women's Health Institute in Breast Care here at St. Peter's Hospital. She's a native Montanan and a Carroll grad as well. She earned her medical degree at the University of Washington's School of Medicine and completed her surgical residency at St. Raphael's Hospital, which is affiliated with the University of Connecticut and Yale University. Please join me in welcoming Alissa. We also have Jaclyn with us tonight, and we're really thrilled that Jaclyn is here to kind of round out the panel and bring some genetic counseling expertise. She comes to us from Shodair Children's Hospital. She's another Helena native, and she sees patients across the state of Montana for a variety of cancer indications. Jaclyn is board certified by the American Board of Genetic Counseling. She received her Master of Science degree in Genetic Counseling from the University of Colorado. While in grad school, Jaclyn completed intense clinical training in both adult and pediatric oncology. She received her Bachelor of Arts degrees in Human Biology and Psychology from the University of Montana. Thank you, Jaclyn. Justin Thomas, Dr. Justin Thomas, is an oncologist here at St. Peter's Hospital and a member of the highly awarded and highly recognized Cancer Treatment Center that we have here at St. Peter's, which is recognized in the top 1% for cancer care here in the Northwest. So, and definitely a well-loved doctor here at St. Peter's. Dr. Thomas is also a Carroll grad and a Helena native. Earned his medical degree at the University of Washington School of Medicine in 2006. He completed a medicine residency at the University of Utah and affiliated hospitals, and an oncology fellowship at the Huntsman Cancer Institute at the University of Utah. Please welcome Justin with us. So when we set to put together a panel for tonight's talk, we're thinking about who we want on this panel, and Dr. Thomas, a great addition, and Jaclyn Foster with the genetic counseling. Dr. Abentroth, a surgeon and a huge advocate for breast health here in cancer, and I'm sure many of you have seen her in the community before. And she's usually at the Tough Enough to Wear Pink rodeo and often participating, and just a real advocate for our health. So terrific addition to the panel tonight, too. Thank you. And Pam, just a terrific navigator and kind of walking all of our patients and residents here in the community through that process. But we want tonight to be focused on health, not just cancer, because health is something that applies to each and every one of us. So we wanted to get started with just a little bit of a kind of warm up the room here a little bit. So anyone bring their smartphone, cell phone with them tonight? Okay, yeah, we're going to try something here. Yeah. You ever done this before? This is text message bullying, and we would love to exercise the text messaging bullying with you tonight. wearing the most bodacious, whoa, okay. Yeah. Okay, well, runaway race of one right now. Okay. Keep it open for a little bit. Whoa, for two. Three. We're taking this thing. Justin is taking it. I do think I did limit this to one vote per person, so we do know that Justin isn't ready to vote over there. Okay, so you're getting the hang of this, right? Wow, you're taking it, Justin. Terrific.
It's the light pink.
Yeah. Oh. So now you know how this works. 2 twos, 3 threes, and okay, the girls are putting up a good fight. And now we'd love to move into a slightly more serious question. So, oh yeah. They wanted to make sure you didn't get shut out.
She might be like, comes from behind and she gets all of it.
All right. Next question. We'd love to get a little feel for the audience's habits when it comes to breast health. So, tell us what you're currently doing to protect your breasts. That first one is nothing. I want to learn everything I can tonight, and that's 361655, or diet and exercise, mammograms, and talking to family members about genetic traits. And you can vote for as many of these as you like. You don't have to just choose one. Your votes are not limited. I think you have to send a separate text for each vote. We can make it easy. Yeah.
Take care.
Good.
Yes.
Okay. Interesting. Okay, so we've got actually, this is good to see. We have some people participating across a wide variety of health habits here. Okay, mostly in the diet and exercise realm. So with that, we're going to actually learn about all 4 of these aspects tonight, or 3 of them. Not nothing. I hope not nothing. Thank you. Yeah. Diet and exercise for sure, mammograms, and genetic counseling, genetic traits, and what that means for all of us. So with that, let's get launched into this evening's discussion. And I think first we'll just love to open this up to the panel and why are we here? And why do we have to take care of our breasts? Why do they require special treatment? I'd love to pitch that question to you, Alissa, first. Why do we need to take extra special care of our breasts?
Well, because for one thing, besides skin cancer, breast cancer is the most common cancer that women will get. And it's not just 1 in 20, it's 1 in 8 women will get breast cancer. And you might not be affected by it personally, but every one of us knows another woman. We either have a friend, a sister, a mother, a daughter, an aunt. We will all be affected by breast cancer in this room, either personally or through our friendships and our relatives. So it's super important.
Great. So we'd love to kind of learn how we can take care of our girls, so to speak. Pam, can you get us kind of started in that line of thinking? What are some ways we can take care of our breasts?
I'd be happy to talk about that. One of the questions we have talked about the importance of diet and exercise, and so one of the things we are going to offer this evening is a yoga demonstration which is going to stress the importance of exercise and in particular yoga. Research has proven that if a woman increases her activity to at least 4 hours a week, it will definitely decrease your chance of a breast cancer and or a recurrence. And also on the forefront is really yoga and breast cancer. I don't know if it has to do with the meditation stage and, kind of quieting those cells and just the stress of everything, and it just kind of wraps your, body in a warm feeling. But yoga is on the forefront. We've got people going to Washington, D.C. and doing yoga exercises on the steps of the Capitol. So without further ado, I would love to introduce a couple gals from Capitol City Health Club. We have Gina. She is our yoga instructor, and I believe she's going to talk a little bit more.
So hello, my name is Gina, and I teach a class over at Capitol City Health Club. Talking about yoga, there's a lot of good things that yoga does for us. For one, it does just help us kind of stop and learn how to breathe and to relax our body. But then also when you get into the movement, it helps to get the lymph flowing, get the circulation going, which helps to get rid of toxins and all those wonderful things. So I'm going to have my friend Sarah come up. She's a Zumba teacher actually at Capitol City, which is also very good. And she's going to demonstrate how to do sun salutation. And it's a really simple, it's one of the most basic things in yoga, and there's different ways to make it easier or harder. But so we'll just go ahead and start. And she's going to start in prayer pose here. And inhale our arms up. Swan dive down as she exhales. Inhaling, bringing the back up into a straight. Exhaling down. Inhaling, stepping the foot back. Exhaling down into plank. And here you can bring your knees down if you want. And then she's going to exhale down into the floor and move into cobra. So this is full cobra. Then she's going to inhale, press back into downward dog. And this is really nice. It opens up this part of the body, gets the lymph flowing under the arms. And then stepping forward. Inhaling back up into prayer. Exhaling down. And if you would, maybe do it one more time, facing the other direction so you can get two different angles. Yeah, facing straight ahead. So again, inhaling up, exhaling down, inhaling back up, exhaling down. And here she's going to drop her head and just kind of hang there. Just doing this is a very nice pose. Now inhaling, stepping the foot back. Exhaling down, keeping the elbows tight. Inhaling up into cobra. And exhaling back. It just makes you want to breathe, doesn't it? And then stepping forward. Now at Capitol City we offer, thank you Sarah. At Capitol City we offer different levels. So I offer a class with the Mitra, and it's kind of nice because you get to come in and the first thing you do is lay down. So I'm going to have the two come back up, and you might not be able to exactly see everything, but we'll just do a really quick demonstration. Maybe one of you could be this way and the other this way. So first, yeah, Sarah, would you maybe want to do it? That's good, yeah. Always think. So you're basically aligning that with the bottom of your sternum. Kind of lines up with the bra. And come back. Bend the knees. Place them hip width apart. Placing the hands on the ribs. And this is how we start. So we come in and we realize that we spend all day running around without even taking a deep breath. It's funny, right? And our lungs come all the way up to our clavicles and they move all the way down here. But we breathe just right here. So if you come to my class, the first bit of the class we would just be breathing. You would just feel your breath, trying to breathe all the way up to the top. And this will be a fast-forward demonstration. So then we're going to bring the arms up, shoulder width apart, relaxing the fingers, bending the elbows slightly, checking back in with the breath, and then slowly exhaling the arms back towards the wall. And normally you would just move inch by inch with your breath to get the arms down to the floor. And we also have blocks and such. So you see her elbows don't want to come down to the floor all the way, and that's perfectly fine. We have blocks that we would normally put underneath here. And it's nice because this opens the chest. I've had some ladies come in and they've had breast cancer, and it helps to open up that tissue. Also gets the lymph flowing and all of those good things, and at the same time it's aligning your spine and relaxing the muscles on each side of the spine. So we're going to have them inhale back up, the arms, and then you can kind of bring your fingertips together and inhale hands down to the belly button. And you'll notice that the pressure is going to bring to the lower parts of the shoulder blades. So anyway, again, this is a really fast demonstration. We'd love to have you all come and try out all the different classes that we have to offer, and it will do nothing but good for your body. And we have some schedules on the back table there, so feel free to grab one before you leave. And thanks for coming.
I was just wondering if there's any simple exercises that with very little experience in yoga you can apply in your everyday, even sitting at your desk at work, or maybe you're waiting to pick your kids up after practice. Are there just some very simple breathing or stretches that you would suggest for people?
Yeah, definitely. At the desk there are, just breathing, just engaging yourself in breath is a really good technique too. You'll find if you're kind of getting sleepy at work, you just take some time to take some deep breaths, and that's all that you do. You're going to feel refreshed, and you're going to feel better. But another one is if you're just sitting at your desk, you want to square out your, you don't want to be sitting with your legs crossed and all. So yeah, you guys can all kind of be my picture. And so you're going to sit nice and straight, let the shoulders drop down. Pay attention to your pelvis. A lot of times we're sitting and we have this kink in our backs. But if you just tuck that down while you're sitting, that's really helpful right there. Help with lower back. And then also you can inhale, exhale, and you all can do this with your hand. So inhale, exhale the head over, and just let the head stretch the side of your neck. We're breathing in and out. Exhale, roll the head forward a little bit. And staying over to the side. We don't want to go to the center quite yet, so we're staying to the side. Inhaling, rolling the head back a little bit. Get the front of those neck muscles. Inhale back to center. Might as well do the other side. Exhale over. And of course, this is in fast forward. So we hold these a bit longer. Exhale the head forward just a bit. You're getting the back of these neck muscles. Inhaling, you can even reach up and feel the muscles that you're stretching. I like to do the opposite hand. Inhale back to center, and just take you maybe 3 minutes to run through that. It's going to make your neck feel better, and if you did that once a day, it's going to help a lot. Also, just moving the body to get the juices flowing is kind of a good thing. I like to, it's called the bear. And like I said, the one where you're just kind of bending over and hanging, it's good to let the spine hang like that. I think a lot of us, we go through an entire day without ever relaxing our neck. Where if you just kind of bend over and let that head hang, it's really kind of a good release. Yes?
Thank you, Gina. That's terrific. Some good everyday tips. And I'm catching myself crossing my legs and sitting improperly in my chair right now. So thank you for that.
Can I just interrupt for just a second? I just want to say one other thing about Capital City Sports. It's not even really a plug for them. In addition to this preventative thing and being healthy and feeling great, yoga is awesome. At Capital City, for our survivors, they have a free class for exercise. And I know that a lot of my survivors just love it. It's run by a gal named Tammy, and she's just a beautiful lady. And she runs the class, and I know some of the ladies go mainly just for the social support, not even for the exercise. So I just wanted to say that about Capital City. It's a wonderful asset that we have in this community that I wasn't familiar with until I came back to Montana. So it's a wonderful thing. Awesome. Awesome. Love it.
Great. Thank you very much for that. It's great to introduce some practical tips for us in terms of how we can increase our physical activity. Thank you very much. So Pam, you also mentioned diet. Tell us a little bit more about diet and how that can increase breast health.
So one of the things that we really want to emphasize with diet is making sure that you are limiting your processed foods. Sorry, I'm not flying here. Your processed foods, certainly red meats, you want to eat those in moderation. And if you could really start to increase your cruciferous vegetables, those are things like broccoli. We actually have a salad that's going to be coming around that you gals can sample. The salad consists of broccoli and some quinoa, which is also a benefit. It's one of the lignans that are really promoting excellent breast health, as well as some blueberries full of antioxidants. If you paid attention to the little spritzer you had this afternoon, they had some berries in there which are also high in antioxidants, and they can definitely help prevent a breast cancer. So you really want to make sure that you're making the proper diet changes. If you have questions about what types of foods are the best to be incorporating into your diet, when you have an opportunity after you leave tonight's discussion, inside your bag is a shopping list that shows all the great foods that are great for fighting, warding off breast and ovarian cancer. So
The salad that you're eating is one of my favorites. St. Peter's chef Kara Anderson crafted the recipe, and often it's what I go to when I did pack a lunch here at St. Peter's. But it is, as Pam said, just superfood packed. It has whole grains with quinoa. It has berries with those antioxidants that Pam mentioned. It has the cruciferous. It has, I think, maybe even almonds in there. So really, really good dish.
Where's the recipe?
And the recipe is on the back of your program. Yeah. So we'll be passing some things to kind of keep your appetite at bay, because we know it's kind of dinner time right now throughout the evening. That's just the first to come. So back to you, Pam.
another thing that a person could incorporate into their lifestyle is adding spices such as turmeric. We will also be passing around a roasted cauliflower with turmeric seasoning, so you guys can sample that and see how good it actually is, and it's pretty easy to make. I actually saw on Facebook a picture of a roasted cauliflower, and it looked fantastic, and someone I had mentioned it to said that it was really yummy. So, something to consider. Also,
we can talk about turmeric. What is it about turmeric? What does turmeric do? It's just known to ward off breast cancer?
Yep. It definitely, it has, it's, again, with the antioxidants, fighting off, making sure that your cells are getting nice and healthy, and,
Interesting. I mean, we all have it in our cabinets, and I just learned in talking to you last week that it was cancer fighting.
Yeah, it's not something you typically would think of as adding into your diet, but you can certainly incorporate it into a lot of different dishes. It doesn't have a very overpowering flavor, so you can kind of hide it too.
Good. A couple other items that we have on tap for tonight. Do you want to talk us through those, and they'll eventually make their way through the room, but we'll let you guys have an opportunity to finish what's in front of you first.
Absolutely. One of the other things that we'll be passing around is green tea, and you guys have probably heard about the importance of green tea. The recommendation is at least 3 cups of green tea a day, and that is, again, beneficial in warding off breast cancers and also just maintaining the good health. And we, again, will be passing around tea, so you girls and guys can sample that. And another thing that is really getting a lot of press lately is vitamin D. What is the importance of vitamin D and why should we be using vitamin D? Research is really starting to show that vitamin D levels, especially in the northern climates, are low. We could go out in the sun every day, recommended 15 minutes, but we're far enough from the equator that even if you are getting, out in the sun, you're not getting the proper amount of vitamin D. And then, of course, we don't want you getting, a skin cancer. So we don't want you sitting out in the sun forever trying to obtain this vitamin D that you're just not going to be able to get here. So you can certainly try, calcium, orange juice, fortified cereals, breakfast cereals are really getting fortified with the vitamin D. And then, of course, you could always take a supplement. It's really, really hard to have too much vitamin D in your diet, but if you have any questions at all, there is a simple blood test that your provider can check to see what your vitamin D levels are.
Okay. I do think we have a sweet treat coming up later.
Yes, we'll be topping this off with some dark chocolate, which again is high in antioxidants. So don't think these diet changes have to just be, healthy foods. Like, there actually are health properties in chocolate and dark cocoa. So you want to make sure that you allow yourself to have those treats, but make sure you're doing it in moderation. And also, the dark cocoa is really the one that's got the health benefits. So if you are going to indulge in some chocolate, try the dark chocolate. It is an acquired taste.
I think we've actually got a couple different varieties of dark chocolate being passed tonight. So one around 60% and some I think in 70s or 80s. So if you haven't had the opportunity to try some of those darker cocoas, darker chocolates, it's a good chance to do it with not a lot of commitment, tiny squares. So
You're welcome.
Great. Okay. Thank you, Pam.
Just a little bit to that. Pam and I went to I can't remember that lady's name, the doctor.
Dr. Christine Horner.
We went to a talk in town, and it was a general surgeon that had become a plastic surgeon who now is more of an osteopathic type physician dealing with a lot of these things. I think one of the most interesting and convincing things that really changed my practice, I talk about some of these things with my cancer surviving patients, because I'm convinced, and I've read some of the studies that are outlined in the end of that particular physician's book. There's an observational study. It's not a tried and true scientific study, double-blind, placebo, all of that, but it's a really nice observational study that was done on Japanese women. Japanese women have the lowest incidence of breast cancer of any nation. And if you think about a Japanese woman in her own culture, drinking green tea 3 times a day, meditating, probably doing some form of yoga or deep breathing, eating lots of cruciferous vegetables, bok choy, cauliflower, broccoli, and I don't know about turmeric in Japanese food, probably not too much, but again, eating very healthy foods with a very healthy, lower stress lifestyle, they have this low incidence of breast cancer. Now you take that same Japanese woman and you bring her to the United States, and she keeps her exact same lifestyle. She stays in a Japanese community, she still drinks her green tea, eats her same diet, does her meditation. Her incidence of breast cancer stays exactly the same as it was in Japan. Now you take that same Japanese woman, you bring her to the United States, and you put her into our culture, high stress, never taking a deep breath, not even hearing of green tea, drinking Starbucks coffee every day. Vegetables, what are those? Hand me a hot dog, it's quick, and I can eat it at lunch. That Japanese woman will then have the same incidence of breast cancer that we American women have, 1 in 8, 1 in 9. And I know that's not, like I said, a really true scientific study, but it's an observational study where they did observe Japanese women in both groups, the ones that kept their cultural values and diet values, and ones that incorporated the American values and diet. And to me, it was so compelling that I mean, I'm convinced that obviously there's a genetic component to this, but there really is an environmental component to all of this.
And if I could just piggyback off of what Alyssa said, I feel like the Saturday Night Live skit. But I did want to stress the importance of sleep. One of the things that Dr. Horner also emphasized is making sure that you're going to bed no later than 10 o'clock at night, and make sure that you're waking up no later than 6 o'clock in the morning. We want to make sure that our bodies have the opportunity to rest. Your cells need to be quiet in order to regenerate themselves. And if we're not getting the proper amount of sleep, those cells are going to wreak havoc, and they're going to just kind of start proliferating and doing things. It may not be a cancer, but it could certainly be another disease that a person could develop. So, this isn't just for a breast cancer thing, this is just your overall general health, is to make sure that you're getting the proper amount of sleep. And one of the things that actually promotes sleep is exercise. So it all kind of ties back in together. And, if you're finding that you're very stressed and you're having a hard time falling asleep, sometimes it's nice to just kind of do those meditation things, take a few deep breaths and, just kind of start at your head and work your way all the way down to your feet. And before you know it, that'll become a routine and your sleep patterns will start to improve.
So a minimum of 8 hours a night. So
Yes. 8, but no more than 8, because if you sleep more than that, then your body still gets confused. So you really want to make sure that you're, consistent. Those times, for whatever reason, 10 to 6 is the best time to rest your body.
Thank you. Any other thoughts on prevention before we move on to our next topic? Okay, great.
No smoking. Everybody knows I'm a stickler.
All right. Take the stage when you have it, right, Alyssa? Yeah.
Sneak it in.
Yeah. All right. I did. I'm gonna have to get up here. Too much talk.
How did y'all enjoy your samples? Good. So, like Katie had said, the recipe for the quinoa salad is on the back of your program. So if you didn't get a program coming in, make sure you grab one on your way out. Try your salad at home.
We're having a couple technical difficulties, but that's fine. We can segue into our next topic, which is about breast self-exams. So, Alyssa. Hello. Okay. We'll watch this first.
Can I get that white, please?
I stopped it because you didn't see the first part of the video, which was kind of important to setting that up. So, let's try that again.
Can I get that white, please?
So a lot of people check you out or you check yourself out. Good message. Back cues up. Everyone still have their phone handy? Our next question actually is getting at when was the last time you did your breast self-exam? So technology cooperates with us again. We'll do that one more time. If it doesn't, we'll just move on to Alyssa's portion of the talk. So we are dying to know how frequently our audience is doing this. It looks like it's going to cooperate with us, Alyssa. Yeah, for those that are comfortable. Sure can. So the options were, I'll read you the options, and then we can do a quick show of hands for those that are willing. So the options are, I thought that was my significant other's job. 0 times. The second option would be anywhere up to 5. The third option would be 6 to 11, and the other one, the last one, would be every month like clockwork. So we've got 4 options. So in 12 months, in a 12-month time frame. So if you're game, can we see a show of hands for I thought that was my significant other's job? Okay, we have an honest person in the room who is saying, yeah, that's me. Okay, so we've got 1. How about up to 5, anywhere from like 1 to 5 times a year? Okay, 10% of the group. 6 to 11 times? 40% of the group? Every month like clockwork? Interesting, okay. So I'd say most of those folks are ending up in that kind of once every 2 months category. What do you think of that, Alyssa?
I mean, that corresponds with when I asked my patients that question. Some of it's generational too. Women of my mother's generation, which are around 70 and above, are a little bit more modest than the younger generation. And a lot of my older patients just say, I don't feel comfortable examining my own breast, and they do leave it up to the clinician. And then I always stress how important it is to do that self-breast exam, because the clinician is only doing it once a year versus they need to do it every month. And then I would say the majority of patients do say that, every other month. And I think part of it is, again, just our busy, crazy, hectic lifestyle. But now we all have smartphones and calendars and easy ways to remind ourselves. And so just like we brush our teeth to prevent cavities, we should set up some sort of a reminder in our phone. It's really funny, I do it on the Schwan man's schedule, which is really hilarious, but because he gives me a sticker. It's crazy.
Awesome. Whatever works.
But it's on my calendar at home, and it's bright orange, and it's just my reminder to do my self-breast exam. I mean, I guess I could do it on my phone, but there's many ways that you can do it. You should do it the same time every month as well, because your breasts do change. Not so much after we've gone through menopause, but before that, our breasts change dramatically as we cycle. And so if you check your breasts right before you're starting your period, they're going to be tender and lumpy, bumpy, and different than they would be mid-cycle or even just right after you've had your period. So just making it the same time every month is also helpful.
When do you suggest people start with their mammograms?
Well, with mammograms or self-breast exams.
I'm sorry.
That's okay. With
Yeah.
self-breast exam, I tell teenagers, I mean, we just did that talk on Taking Care of Your Girls, which is an awesome book for moms with teenage girls on talking about breast health specifically. And I tell girls and young women, start when you're a teenager or in your 20s. It's never too young to get to know your own breasts. It's you that's going to do that exam every month. It's you that's going to notice something different from the month before. And so for me, starting in your late teen years, early 20s is a perfect time to start. And just, again, you get in a habit when you're 2, 3, 4 to brush your teeth twice a day. This is just a habit that you need to get into.
Sure. I like what Pam told me a couple weeks back, which is about know your normal. And so sometimes I think you can be a little intimidated intimidated by exactly, am I doing it right? Do I have the right technique? Things like that. But I found that to be like a really disarming and easier way to, I think, approach that process.
And just knowing, people just think of your breast as the part that protrudes out, that really your breast tissue starts all the way up at your clavicle bone, goes all the way down to that rectus muscle, to the sternal bone, and then all the way over to your latissimus dorsi, which is this muscle out here on the side. As long as you cover all that territory, whether you do it in a circular motion or up and down, that's what's important. And then just knowing you're normal. You might have a little lump and bump, and if you notice that it's there for a few months and you're concerned about it, then letting your clinician know. And then a lot of times they reassure you, say, oh, that feels like something that's nothing to worry about. Then you know that's your normal. And so when you check that lump every month, it's okay. And then the other thing is just checking your armpit. The lymph drainage to the breast is in the armpit, and just checking for lumps and bumps under your armpit.
Thank you. Let's talk mammograms. Okay. Since I wanted to about, 2 sentences ago. There is some conflicting information out there about how frequently we should get mammograms, and even a little bit of controversy around that. Can you set the record straight for us?
Yeah, that's hard. In fact, did you get that email today on Lotus Notes, which I'm like, I can't believe they're sending this out because it's confusing things even more. Traditionally, it's always been start your mammograms at age 40. In the last 5 years, there's been a whole bunch of different groups of people, from the American College of Family Physicians to a nurses group, who have advocated starting mammograms at age 50. Part of that is cost effectiveness. I think that's driving some of those studies. That information came out a few years ago, and what we did here at St. Peter's Hospital, because I'm still a believer in starting them at age 40, so I had, at the time, Carrie Parmer, who was the nurse navigator, gather the information here in this community, in this geographic setting. How many women, or what percentage of our women are between the ages of 40 to 50 here in the Helena area with breast cancer? Who would we be missing if we started at age 50? It was 18% of our breast cancer patients. That's a huge number. When you're just talking about 75 women a year in Helena getting breast cancer, 15% of them, that's a big number. And I will tell you, when women have breast cancer at a younger age, in general, it's more aggressive. So catching that woman between the age of 40 and 50 is probably more important than catching that woman at age 65. There might be studies from New Hampshire that say, yep, this should start at 50, but here, until the numbers are different at St. Peter's Hospital in our community, I will stand firmly that it should be done starting at age 40, and it should be done every year. That's another bit of controversial area of, oh, I can just do it every other year if I'm in a low-risk group. Every year. Again, just do it every year.
Does insurance pay for it at 40?
Absolutely. Even Medicare pays for it. Yep. And Medicaid.
Terrific. So, do you have something
Well,
to
I'm
add?
just saying, if you look at the NCCN guidelines, they're also just reiterating what Dr. Abentroth was saying about just starting at 40, and I think it's kind of the consensus, and it's the thing to do, I think.
Absolutely.
So, for someone,
Carrie has another thing to say. That's Carrie Parmer, who I was just talking about.
so the question is, how long in your life can you ever stop having?
Oh, so at what age should you stop? That's also very controversial, and that's patient to patient. Here in Montana, I just had a 90-year-old patient. She is as healthy as a horse, 0 medications. She's still getting her mammogram. God bless her. I mean, she could undergo a cancer surgery and probably be just fine. She told me she was going to live to be 102, and I actually believe her. So that part is controversial. 80 was traditionally the age to stop mammograms. There is a lot. 80 is the new 70. I mean, I think that number should change as well. Something that happened in our community right when I came here 3 years ago is there were some family doctors telling 60-year-olds, 60 and 65-year-olds that they didn't need a mammogram every year anymore. The peak incident, the peak age to get breast cancer is age 62. Doesn't make sense. So yeah, every single year until your medical problems outweigh you. Again, there's some 75-year-olds that have, horrible heart disease, horrible lung disease, they're probably going to pass from that before a breast cancer, so then they can make that decision on when to stop that screening mammogram. But we have a lot of very vibrant, healthy 80 and even 90-year-olds in this community.
For those that are willing, can we get a quick show of hands of those of you who have had a mammogram in the last year?
I know it's
yeah. Vouch for that. So, Alyssa, can you give us just a little insight? What can we expect if something isn't quite right in the mammogram? What happens at that point?
So that mammogram you go in to have that yearly is called your screening mammogram. And so you just go in for a couple basic views where they compress the breast and look it on the film. The radiologist has criteria of what he or she's looking at to put you in a group by RADs 1, 2, 3, 4. 4 being bad, 1 being normal. When you get in a group of 3, or when there's just not enough information for the radiologist to see, they call you back for a second look. That's called a diagnostic mammogram. That's the one that causes the most anxiety and stress. And what we really try to tell our patients to relieve that stress of an abnormal screening mammo is that 90% of the diagnostic ones are going to be just fine. So it's really a rare, a much more rare event that when you come back for that second look that it's going to be something bad. So to ease that anxiety, that's the number that we tell our patients. When you come back for the diagnostic mammogram, it really is a more firm squeeze is really what they're doing in spot magnification, so the view is more magnified. And sometimes an ultrasound can help them the second time around. They try to find the lesion on ultrasound. So again, they have certain criteria that lets them know, oh, this is something that needs to go on to and recommend biopsy. Or they are reassured and they say, you know what, nothing to worry about. Go back to your screening mammogram. Or it looks okay, why don't you come back in 6 months and we'll do a little bit shorter interval follow-up.
Okay, thank you. Awesome information. We actually have a scheduler here in the room with us tonight. It's Jessica. Jessica, can you throw your hand up back there in the corner? So we just thought we couldn't talk mammograms and tell everyone they need to have them once a year if we didn't give you the means in which to do that. So if you haven't had one in the last year, you'd like to look ahead, feel free to visit with Jessica after the talk tonight, and she'd be happy to set you up with with an appointment. So with that, I think we're going to move on, and let's see if the polling works for us. If not, we can do another stretching of the hands here. It doesn't look like it's going to happen for us. So, quick pop quiz. Okay, here we go. True or false? Most women diagnosed with breast cancer have a history of breast cancer in the family. True or false? False, okay. Anyone? False. The false seems to be taking it for the evening. What do you think, Jaclyn?
I think we have a pretty smart group in here.
Can you talk to us a little bit about this? I think we have a very smart group in here. This was news to me. I really did think when when I got into this industry, frankly, and started learning more about breast cancer, I really thought that a lot of it was driven by family history. So tell us a little bit more about that.
Yeah, absolutely. So we know that about 25% of people diagnosed with breast cancer have a family history of breast cancer. Between 75% of them don't. There are two major breast cancer genes that we talk about in genetics called BRCA1 and BRCA2, and those account for the vast majority of genetic breast cancer.
Okay, Jaclyn, I'm going to have to stop you and ask you, what is BRCA1 and BRCA2?
Yeah, so those are genes that we all have. And the job of those genes is to protect our bodies against cancer. So we have two copies of both of those genes. We inherited one copy from our mother and the other copy from our father, which is why it's really important when we talk about family history that we're also talking about our father's side of the family, because these genes can certainly be passed from that side. When the genes aren't working the way that they should be, because they have a mutation, our bodies are predisposed to cancer development. Now that doesn't mean that you're predisposed to cancer at 100% risk. It's an increased risk, and a very increased risk. We say somewhere between 60 and 90% usually of breast cancer in a lifetime. And up to about a 60% chance of ovarian cancer, somewhere 50 to 60%. We wish we could tell people yes or no, you will develop breast cancer or you won't. And that's a hard conversation that we have.
So what do you recommend for someone who has a family member with breast cancer?
So one of the most important things that I could say is to really spend time talking to your family and get to know your family history on both sides of the family again. I would really encourage the holiday season coming up to take the time to sit down and talk, because that information could truly save your life. You want to ask about things that could be red flags of a hereditary type of cancer going on. So you're interested in people, especially with breast cancer diagnosed at a younger age. So we typically say that age 50 is kind of a cutoff. Women diagnosed with breast cancer twice or multiple primary breast cancers, bilateral breast cancer, ovarian cancer, males with breast cancer in the family. Those are all signs of BRCA or hereditary type of thing going on. And if you do have that in your family, we would highly suggest talking to your provider about a genetic consultation, and we'd be happy to meet with you and talk about what that all means.
What do some of those questions look like? You know, what are some of the questions that you might ask? I'm sure BRCA 1 and 2 aren't terms that we commonly are throwing across the Thanksgiving dinner table, but how would you suggest approaching that conversation, or what sorts of specific questions might you ask?
Sure, and that's a very, very delicate conversation. A lot of people aren't very forthcoming about their cancer history, and it's amazing how often people don't know anything about their family history because it's never talked about. So what's most important is knowing what kind of cancer has been diagnosed, what age was it diagnosed, and on what side of the family. So we're looking for multiple generations of people being affected. Again, some of the same red flags that I was mentioning earlier. But don't be surprised if it's not an easy conversation to be had.
Sure, fair enough. I think we have this. You had to have your head under a rock to miss this news a couple years ago, and Angelina Jolie hit the newsways, really shined a new light on breast cancer. Just curious what your take is on this, and how maybe it shined a light on the work that you do, Jaclyn, or maybe even some challenges.
For sure, yeah. So that's aptly called the Angelina effect, and that's what we call it in genetics too, because since this came out, actually last spring, the referrals to genetics cancer clinic has doubled.
And maybe I should just jump in here and say, and maybe you can just bring the audience up to speed, exactly what drove her decision.
Yeah, so she has a family history of ovarian cancer. So her mom died of ovarian cancer in her 50s. And we know that ovarian cancer is linked with these BRCA genes particularly. So she went in and has not had a personal history of cancer, but because she was being proactive, wanted to discuss. So since she came out with this, the referrals have doubled to genetics clinics, and it's been great because awareness is increasing. The stigma against genetic disease is hopefully decreasing. But it's interesting. I think we need to keep in mind that there's a strong difference between a genetic diagnosis and a cancer diagnosis, and I think that gets confused a lot. Just because you have a BRCA mutation, although you're at very high risk, does not mean that you have cancer or that you will have cancer. It just means you have to be proactive about it. And so there's been some studies in the genetic counseling literature over the past decade and after Angelina came out, and it looked at why do women do what they do after a diagnosis of a BRCA mutation. And it's really interesting. Not what you would expect. So it's not, I want to be healthier, I want to live longer. What these women are saying is, I want my fear to be reduced. And for some women, like Angelina, a double mastectomy is the answer to that, and that's a beautiful choice. For some women, that's not the choice, and there's various, like Alissa was talking about, screening, diet, medication that Dr. Thomas might talk about. And it's really our job to help women navigate that decision, start that conversation with their other providers, and make a decision that feels right to them, because every decision is different.
Do you find that with some of your patients who you counsel on their genetics, are you then bringing in Justin or oncologists into that discussion?
Yeah, so it's a very collaborative situation. So we're often getting referrals from them and then sending them back out to not just oncology, but social workers and other people in the community who can help. This truly is a family matter, so oftentimes the children are involved, and we're talking about testing them too.
Have any of the rest of you been really struck or impacted by this rise in interest in genetics and family history, and has it changed the game for any of you in your practices?
I think it's changed the game for us a little bit. We definitely see more patients just coming in for an analysis and talking about their family history, and then we'll ask them, how about their family history and how significant it is. And if it is, then we'll usually send them over to Shader, which was so nice to have them in conjunction with St. Pete's and Jaclyn and her knowledge base, so that we can talk a little bit more about are they a candidate for further studies or further blood tests to send out and see if they have any of those genetic mutations. And then if they do, they come back and they talk with myself and Dr. Abentroth and talk a little bit more about, are you a candidate for certain types of surgeries to reduce your risk? And what would that look like? Or are there certain medications that we can give you to reduce your risk? And then maybe some other lifestyle modifications. All those things I think we typically go through, and we'll give them all those different options if they do have one of those mutational analyses that are positive. And then talk about how much it's going to reduce the risk and what it means to them. Like I said, it can be complex.
And I think she hit it right on the head when she said, for Angelina, that was a beautiful choice for her. And for the woman who chooses not to do any surgery at all and just amps up their screening, their breast exam, that's a beautiful choice for that woman. Same discussion that I have when I walk women through lumpectomy versus mastectomy, those choices. It's your personal choice. Those results are equivalent. It is, as long as you're at peace with the choice you make for your own body, that's more important than anything else.
It's a difficult situation, I think, to be faced with as a patient, or even to be alongside someone who's going through that. And one of the things that we wanted to touch on tonight was just, 1 in 8 is a pretty staggering number, but if it's not you, you're likely to know someone who is impacted by it. And I know that I have found it sometimes challenging to figure out how to best support and talk to and just generally encourage or comfort those who have been diagnosed with cancer. We found a video that we really like. It kind of hits home some really basic principles in terms of connecting with others in especially challenging times. If technology cooperates, we'll watch it. If not, I think we have some great questions that we can build on that for afterwards.
So what is empathy, and why is it very different than sympathy? Empathy fuels connection. Sympathy drives disconnection. Empathy, it's very interesting. Teresa Wiseman is a nursing scholar who studied professions, very diverse professions where empathy is relevant, and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, I'm stuck, it's dark, I'm overwhelmed. And then we look and we say, hey, I'm down. I know what it's like down here. And you're not alone. Sympathy is, ooh, it's bad, no. You want a sandwich? Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with at least. I had it, yeah. And we do it all the time, because you know what? Someone just shared something with us that's incredibly painful, and we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So, I had a miscarriage. Oh, at least you know you can get pregnant. I think my marriage is falling apart. At least you have a marriage. John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, I don't even know what to say right now, I'm just so glad you told me. Because the truth is, rarely can a response make something better. What makes something better is connection.
Survivors and those who have walked this path in the audience today. So this feeling, and for those of us that haven't, I hope we embrace that. But Dr. Thomas, Justin, I know that you see a lot of patients who have just gotten the word. You're helping navigate through this process. What sort of advice do you give to family members who want to help support their loved one through a diagnosis?
Well, almost all my new patients come in and they either expecting to get the news or have already gotten the news that they have some sort of malignancy. And those can be difficult conversations. I think what you want to focus on initially is making the family at ease and always taking a positive step forward. And a lot of times it can just be the little things that the family can do. Being just there for them, just like that last part, just knowing that there's somebody that they can talk to, continuing to empathize with them, and seeing maybe going out, if they like to go to a certain restaurant, maybe take them out to a certain restaurant or go on a certain drive. Anything that you know is special to them, I think that just kind of raises somebody up for the day. And I think that can definitely make a huge difference. I notice people do much better when they have support from either family or friends to get them through certain hard times, and coming in to get chemo or coming to see Alissa or Dr. Abentroth and having surgery and getting through that post-operative recovery. It's very important, I think, to have some support and also somebody to kind of kick you up and get you moving if you're kind of down for the day. So just the little things, I think, is a real important thing to remember and continue to move forward and always try to take a positive step out of maybe a negative situation.
I'm hearing you say even just normal things too.
The normal things are the things that I think sometimes we forget about during our normal life.
Yeah.
And sometimes it takes, unfortunately, a cancer diagnosis to maybe take a step back and understand how things have been, and maybe you've been taking those things for granted. Maybe it's a nice cup of coffee out on your porch, or a big smile from your kid, or a big hug, or all those little things that it's just normal. And then when you have a cancer diagnosis, all that stuff, take a step back and you realize that how important that stuff is. So,
I imagine the levels of support we need to offer to loved ones going through cancer diagnosis varies depending with the level of cancer that she's facing. Can you tell us a little bit more about the different levels of cancer?
The stages of cancer. So, just like we were talking about earlier, it's important to continue to find these cancers. Any cancer really is, the sooner the better. All cancer cells are, I know Sam Cancer does a big deal these times, is it just cells that change their DNA over time and continue to make themselves over and over again. And what's unique about cancer cells is they can invade into other tissue. And that's unique from other cells. And what's important about that is they can invade into the lymphovascular space, and I always call that the interstate. So they can get onto the interstate, if they go bigger, they have a chance of getting on the interstate. When they get on the interstate, they can get into different tissue types and set up residency. And hang out there and then continue to grow and then cause problems later on. So when we think about the stages of cancer, we have to think local first. So let's think about it like a lung cancer. Somebody has, or we can talk about breast cancer. We're here today talking about breast cancer. So maybe maybe one cell changes DNA over time and continues to make itself over and over again. And it's gotten to the point where you can feel it on your physical examination if you do it yourself. And it's about maybe a centimeter. So just very tip of your finger. That's about 1 billion cells at that particular place. And that would be a stage 1. And then as it continues to grow, it'll grow into greater than 2 centimeters for breast cancer. And if it gets about 2 centimeters and the lymph nodes are still not involved, that would be a stage 2. If the lymph nodes are involved and it looks like it's gotten onto that interstate, the highway system, that would be a stage 3. We call that locally advanced disease. And then if we know by scans or by another imaging that the disease has gotten into another tissue type, that would be a stage 4. So maybe it's in the bones or in the brain or liver or lungs. It's typically the places where breast cancer would like to go. So those are the different stages. And this support for all those, I think initially it's so overwhelming for women and men. The support always needs to be there. And it feels like it's not really different from stage 1 versus the stage 4. I think initially when somebody says to tell somebody they have breast cancer, it's totally overwhelming and they need support from the stages of 1 all the way through, I think. So yeah, it's nice to have that throughout the whole process.
That's a good point. Cancer's different.
It is. Yeah, and for most people, initially when they hear it, they don't know those things, and it's overwhelming. Is that they think they're gonna die tomorrow. Or something's gonna change over the next month, and they're gonna go well. That's not always the case. And most of the time, it's not the case. We're gonna talk about that in a little bit.
Good. Can you tell us about the difference between a lumpectomy and a mastectomy? I think those terms are thrown out very frequently in clinical settings. I think for those of us that are new to breast cancer,
that's right.
What's the difference?
Yeah, I don't know. This is Dr. Abentroth, do you want to do it? I'm happy to do it. Yeah, this is your field. That let me know if I'm doing it wrong. Don't do that. So there's two different. When you do get a diagnosis with breast cancer, what happens is you initially will meet with Dr. Abentroth or myself, and after that you'll decide whether or not you want to do. You have to think about local therapy first. So you want to the treatment is a surgical treatment, and then the chemotherapy and the radiation therapy can just be adjunct to that. So when we think about that, we have to decide whether or not we're going to do a mastectomy versus a lumpectomy. Mastectomy means that typically the entire breast would be excised, and at that point, be able to send it off for the pathology. You can either do that versus a lumpectomy, would just be part of the breast. And there's certain places that are more ideal perhaps to have lumpectomies. Typically, the patients that are most ideal are the patients that have upper outer disease. So on the upper outer part of their breast, where it'd be an easier excision for Dr. Abentroth and the like to get that tissue and make it look aesthetically pleasing afterwards. Patients who are not candidates for those are patients that have larger disease. Maybe it's multifocal, it's in different places in the same breast, or maybe at that location, like right under the nipple, that would be not as good, not as aesthetically pleasing, I guess, the after product. So, mastectomy, where they cut the entire breast off, versus a lumpectomy where just part or partial resection would be done at that point.
Is there an advantage to one over the other?
You know, I think that's the biggest misnomer for people that come in. What's interesting is that actually there is no difference, not only in recurrence rates but also overall survival. The caveat is if you do if you do a lumpectomy, you'll have to couple that with radiation therapy. So you'll see Dr. Pupino after you see Dr. Abentroth in between to have those patients do just as well as each other. So a woman that has a mastectomy versus a woman who had a lumpectomy and radiation therapy should do exactly the same over time. If you look at their recurrence rates and also their overall survival rates.
Interesting. So since you're getting in the business over there of deciphering one term from another, can you tell us a little bit more about the differences between chemotherapy and radiation therapy?
Yeah, there's a big difference between those two things. And I think some women are more nervous about one or the other. It seems like somebody's always adverse to one or the other when they come in. And it just takes a little bit of education about what those entail, I think, for some of those doubts and fears to kind of go away. So radiation therapy is what Dr. Pupino is able to do. He's able to bend high energy high energy protons and different, I don't know, what's a particles.
It's like a lightsaber.
Basically, it is like, yeah, they're high energy particles that he can change, and then they direct specifically to damaged tissue or carcinogenic or cancer type tissue to help kill it. And when you think about radiation therapy, you think about local therapy. And that's the distinction for me. Surgery and radiation therapy are trying to make the cancer, whatever type of cancer, not come back in that exact area. But when you talk about chemotherapy is typically given in IV form. It's a liquid, and it kills all dividing cells. So when it goes through your body, it's looking for dividing cells at that time, enabled by different mechanisms of action to kill certain specific cells that are dividing at that time. So if it sees a cell that's dividing, there's a mechanism where it's going to be able to try to stop that cell from dividing and kill it. And that's why some people, depending on the types of chemotherapy we use, will lose their hair because our hair cells are always dividing. And our bone marrow is always dividing to make more red blood cells and white blood cells and platelets. And some of our GI tract are always continually dividing. So that's where some of the side effects come from. And over time, we'll continue to be more and more personalized with our medicines. Change overnight, and it's been more there's a lot of biological therapies now that are heat-seeking missiles just to cancer cells, rather than the traditional chemotherapy that's kind of had a bad stigma over the last 15 to 20 years.
Yes, answers the question for me anyways, although I'm sure there's some in the audience, and I'd love to get to those. I think before we open it up to audience Q&A, I'd just love for the four of you to kind of send us home with one key takeaway, and I'd love to start it with you, Pam. If there's one message you want people to leave with tonight, what is that message?
What I would like to send you gals and guys off with, a message is be good to yourself. Make sure that you do make diet changes. Go to sleep at 10 o'clock. Sleep until 6 o'clock. Make sure that you're doing your yoga or your runs or walks. You know, take time for yourself. We as women have a really hard time doing that. So if I could just encourage you to just do one thing tonight, it's please go to bed at 10 o'clock.
Alyssa?
And kind of on that same note, I mean, you own this. It's your body. Check your rest once a month. Just like Justin said, if you detect it early, it's more curable than something that's later. And so this is something that you actually can actively do every month for yourself that's going to make you healthier.
Jaclyn?
We're all at risk for breast cancer, regardless of our family history. Although, please take the time to talk with your family and get that history and be proactive.
And mine is always, even if you are diagnosed with cancer, it's not always doom and gloom. even stage 1 and stage 2 typically have a greater than almost 89% survival rate at 5 years. Those patients do fantastic. And just to piggyback on what Dr. Abentroth said, trying to catch things early and getting the mammograms once a year are very important. We can get you in that 90% range, which is that's fantastic in our world. So I think that's the take-home message. Continue with the mammograms, and it's not all doom and gloom if you have to hang out with us.